Diabetes has become quite common, whether we're talking about insulin-dependent type 1 diabetes or adult onset. So what happens is both the circulation and the nerve system in the feet can be affected. The vessels and the nerves are smallest out into the feet. As they move away from the center part of the body and go down into the feet, they get smaller and smaller until you enter the toes, and diabetes can affect one or both. So an abrasion or a callus can occur on the bottom of the toe or on the ball of the foot, and left untreated, that abrasion breaks down and we have an ulcer. If one has a circulatory problem, then we run the risk of that ulcer enlarging. We run the risk of developing gangrene. We run the risk of possibly losing a toe. We run the risk of possibly losing more of the foot. So we have to be extremely careful if we have diabetes. Even if you have no lower extremity complaints, a visit to a podiatrist once a year just to sort of do a baseline exam, check circulation, feel for pulses, check nerve sensation in the feet is imperative. Examination of the feet. If you can't see the bottom of your feet, if you're diabetic, if there's somebody at home with you, once a week, have that person at home inspect the bottom of your feet, looking for any abrasions, cuts, wounds, redness, drainage, etc. If you're alone, then get a mirror, put it on. Do not ignore anything on the foot if you're diabetic. Again, any cut, any wound. I have seen just horror stories when one loses sensation. So that's what's called neuropathy, diabetic neuropathy, where the nerves sort of deteriorate, they degenerate, and you don't get that normal sensation from the brain to the foot, from the foot back to the brain. We don't feel, somebody with diabetic neuropathy may not feel a cut or a wound. I've had patients who were walking on a golf tee that was stuck through a shoe into the foot and had no idea until the foot became infected. And once it's infected, then we really have to be aggressive. Treatment with oral antibiotics, obviously, sometimes IV antibiotics, sometimes referral to vascular surgeon to evaluate whether a bypass surgery is needed to get better blood flow to the feet. So word to the wise, just do not ignore, don't think it's going to go away, have it checked. And